हाँ.
Exosome.
Exosome.
Huh? First. So हम लोग बुक से हम लोग आपको डायरेक्शन पेन ड्राइव देंगे. या आपको बुक चाहिए तो बुक बाद में टू राइट. आज चिट नहीं निकाला. आज अभी किसी का नया लेक्चर नहीं हुआ. अभी लेरॉय के बाद चिट निकलेगी.
ओ ऐसा है क्या?
I don't know. Why? Where were you?
I was sitting there, someone is sitting.
तो फिर? If there is if it's empty, you sit. Where is
There
your
is
place?
over there.
There is no extra people. So where you are?
I don't know, Dr. Lady.
Where was she sitting?
I was sitting there. Anybody sitting over? Pallavi.
Nobody is sitting now. Oh, this gentleman.
That's Pallavi.
Get one chair and sit.
Yeah.
दो बार हम मिले हैं कॉन्फ्रेंस में.
Yes. So we have Dr. Leroy Rebello. Okay. I mean, there is the introduction to Dr. Leroy is very small. He is an inventor of nanocurcumin, inventor of
Leroy's cocktail.
lysate PRP. Okay, and now autologous exosome is this new kid, right? And Leroy's cocktail, which he's going to talk about, right? So Leroy, how we do Myers cocktail? Dr. Leroy has made his own formulation called Leroy's cocktail. Okay, and I think I am the most. I've practiced it the most. So you can ask about the experience of Leroy's cocktail from me, but he can definitely let you know what all. So today he'll take exosome.
Yeah,
what else?
exosome.
Hair PRP. So he has also developed a growth factor.
Concentrate. Yeah.
इधर है?
No, इधर नहीं है.
इधर नहीं है.
इधर video recording.
अच्छा. So welcome Dr. Leroy.
Thank you.
For 125th Ozone Forum of India's
Wow.
training program. And
Wow.
Who will take exosome? We will come to know once Dr. Jignasha comes. You first finish.
Yeah.
the theory,
So
then-
thank you all for coming here and allowing me to speak. We'll talk about exosomes. How many of you are already practicing, have already heard of exosome? Oh, very good. 1, 2, okay, very good. So 3, yeah. I would like you share your experience. I mean, what do you use it for? And
I've not used it. I've just
heard
theory part.
theory. Next, somebody. Doctor.
After laser, fracture laser, I've used exosome so many times and use prediction for scars and healing.
Okay, for scar revision. Good.
Just 2 minutes. Before, so Dr. Jignasha, you have patient for hair. Okay? And you don't have patient for face PRP. And you don't.
You want face PRP?
So, for Dr. Leroy, okay, what I will do is Dr. Leroy will choose who will get exosome.
No.
No.
She has done maximum exosome in India. You should choose.
नए स्पीकर निकाल रहे हैं, आप एक निकालो.
आप निकालो एक. चलो एक. So whoever's name comes will get exosome today, and it is worth 50,000 treatment. So जो भी है तो अपना celebration कर लो. Training free हो गया. वाह. Dr. Anjali. Woo! Okay. And face PRP, who will get? जिसको नहीं करना है, you can decline, ना? It's okay. Exosome तो कभी decline मत करना तू. डॉक्टर निरंजन राय लेगो, आप लोगे नहीं तो किट आपके लिए दे देंगे. लेंगे.
बाद में
So-
आपका 3 और है.
Okay.
Okay. So over to you.
Yeah.
I will go and see some patients.
Sure, sure. Thank you. So first we'll talk a little bit about exosomes and what is the difference and also the legal aspects, because now there are three main things going on in the market: exosome, PRP, stem cell, fat, autologous fat transfer. So first, before going through all these things, let's talk about the legal aspects. Are these things legal or are they illegal? So ICMR has put out a guideline saying and telling us what can be done in the clinic and what cannot be done in the clinic. So what can be done? So if you talk about first stem cells, any type of manipulation of stem cell which involves culturing or changing the cell type is illegal, except in leukemia, or for the bone marrow. Everything else has to follow these three conditions. Number one, it should be autologous. Number two, it should be within patient and the doctor. Number three, it should be minimally manipulative. Now, the definition of minimally manipulative has also been mentioned. What is minimally manipulated? Minimally manipulated means it cannot be cultured, you cannot change the cell type, it should be a single sitting, it can involve centrifugation, it can involve filtration, and it can involve incubation. That is what is minimally manipulative. So if you are doing any of these other things in your clinic, you need ICMR guideline. So whether you are doing ozone major, ozone minor, it is between doctor and patient, it is minimally manipulative, you are doing some filtering of blood and you are putting an add inside. Secondly, there should be no chemical added. That is also what they talk about.
Chemical means,
Any drug,
so for example,
heparin is allowed. You are taking some other drug that is not approved and you are mixing that drug and then you are putting back inside, that is not allowed. So that is what the law says, because it's very important, since we always follow the guidelines of the law. Coming to PRP, I know everybody has been doing PRP since a long time, so I will just go through it in a few sentences. Basically, what is PRP? You are taking out the blood, you are separating the platelets, you are concentrating the platelets. How do you concentrate them? By spinning them. So you concentrate them to 10x the normal platelet value, and you can also check, that the platelet value is 10x, and you can inject it. Now these platelets have all the different types of growth factors. PRP has two basic types. One is low leukocyte PRP, one is high leukocyte PRP. So where to use low leukocyte and where to use high leukocyte? When you want some amount of inflammation, you will use high leukocyte PRP. Where you absolutely don't want any inflammation, purely regeneration, you will use low leukocyte PRP. Then there are so many different types of tubes, there are so many different types of theories. Some people say it should be double spin, single spin. So when would you want to do a double spin? When you want to do a single spin. If you want high leukocyte PRP, you will do single spin. You want low leukocyte PRP, you will do a double spin. Which are the tubes to use? There are different types of tubes available in the market. Some are GFC tubes, some are normal tubes, some are the gel tubes, some are tubes with acid citrate dextrose. There are some tubes without acid citrate dextrose. So which tubes to use when? When you want to do any scaffolding in the body in regeneration, you will use something with acid citrate dextrose, ACD, okay, or it is also called as GFC, growth factor concentrate. If you want to do something like a general PRP, you can use any other of the tube, but make sure your platelet concentration is high. Never use plain tube. Why? Because in plain tube what happens? Huh? Coagulation happens. So all the platelet gets destroyed. So always use some anticoagulant. So some people are allergic to heparin, so I would not recommend using that much heparin unless the patient is given a little bit, tested or something, or they know. You can also use citrate. Citrate is an anticoagulant. You can use EDTA. EDTA is quite good actually. Formerly when we started using PRP, we were only using EDTA tube because at that time nothing was available apart from EDTA and citrate tube. So citrate is generally the bluish tube, EDTA is the purplish tube. The growth factor tubes are always written over there, it contains certain growth factor. So generally they add ACD, acid citrate dextrose, and they call it the growth factors because ACD activates this growth factor. And how do you know it contains the growth factor? Very simple thing is that you take the tube, you spin it, you take out that PRP, you can either give it to test in the lab where they do the CBC machine and you can see the platelets are increasing. If you do not have that, still a simpler way to do is that you take it, you put it in a very syringe and you keep on agitating it. It will start forming a gel, that means platelets are present. Okay. Now, what is the difference between autologous exosome and PRP? I will tell you, because all look the same, stem cell looks the same, they will take the blood, correct. Every time people take the blood or you take the bone marrow. So, how do you know that this is a stem cell, this is a PRP, this is an exosome, what it is? Because many of the patients come and they say, doctor, he has taken the blood, he did something, 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 and they have given me. So, generally when we want to give stem cell, so what do we give? We give basically, there are 2 types or 3 types of different stem cells. If you see from blastocyst, anything taken out from the blastocyst is pluripotent. Pluripotent is not allowed as per the law. Okay? We cannot give IPCs, we cannot give pluripotent. So you have to take from the second cell line or third cell line. So where is that second cell line or third cell line? This is always found in the junctional tissues. So where are the junctional tissues? One of the junctional tissues are in the bone marrow, correct, where the bone marrow touches the bone. The second junctional tissue is in the limbus, where the cornea touches the sclera. The third simple bone marrow is in the teeth, I mean in the junctional tissue is in the tooth, where the tooth comes to the gum. Then you have in the epidermal, dermal junction. So all over the place you have junctional tissues. So you take out this, you can take out these stem cells, you can process them and you can either inject them on the site. Or you can, if you can process them well, filter them well, then you can give them IV. So, and generally before giving stem cells from blood, we always give something called GC-MAF, that is granulocyte GC, coronary macrophage stimulating factor, okay, or macrophage activating factor. So GC-MAF. So when you give GC-MAF, you get 10 or 20 more types of granulocytes coming out in the blood, and these granulocytes can be used for your treatment and all that. So it's always better 1 week before give a subcutaneous injection of GC-MAF and then you can get good quality of stem cells. Within a week you can even get a normal blood test and you will see the granulocytes increasing. Secondly, so we talked about the stem cells. Stem cell from bone marrow. Why stem cells from bone marrow? Because in the bone marrow the stem cells are present over there, but they are already differentiated stem cells, so they cannot cause cancer. Okay, so they are safe. So you can promote, you can use the stem cell, you can inject it. How will you inject it? You will minimally manipulate. So what is again minimum manipulation? Centrifugation, you can do filtration, okay, and you can dilute with normal saline, you can inject it. You can either inject it, some people, doctor are injecting intrathecal, you can inject it in the joint, you can inject it IV, it's safe, it can be do, but always better done under supervision. Okay. Third, PRP, we spoke about the PRP, the different types of PRP. Presence of platelets in the blood means PRP. Now we come to the next thing, exosomes. So what are exosomes? Okay. So So, exosomes are extracellular vesicles, okay, that come out of the cell. And if you see, the cell has a boundary, and anything that comes out of the boundary is an exosome. Now, you all ate food, right? All happy, right? Everybody ate food, they are all happy. Okay, so if I test your blood, what will I find? Will I find the food in your blood? Then what I will find? Glucose will increase, fat will increase, something will increase, chylomicrons will increase, correct? But I won't find the food in your blood. Now, suppose in that food I had put a paracetamol. Will I find the paracetamol in your blood? Yes, correct. Why will I find paracetamol and why will I not find the food? Pardon? What is easily absorbed? Paracetamol is not metabolized by a gut microbiome. So, paracetamol crosses your gut blood barrier and goes directly in your gut. Same for many of the synthetic drugs. They do not get metabolized by a gut microbiome, and they go and you can test in the blood. But your food, you ate the food, your bacteria ate the food then. After your gut microbiome or bacteria ate the food, the bacteria secreted certain enzymes, the bacteria secreted certain metabolites that comes in your blood. So, can you test that, right? You can say, why can't we test metabolites, correct? Can you test that? Huh? Yeah, you can test that, but the problem is you can't make any standardization of the testing, because your gut microbiome is different, his gut microbiome is different, everybody's gut microbiome is different. So, nowadays there is something called gut microbiome test. You know, you can give the stool, get your gut microbiome test, get your neurotransmitters tested, get something called your free organic acid tested, and that tells you which microbiome is there and which is not there. And then you can get that particular probiotic, prebiotic or postbiotic. We will talk about that also. We have time tomorrow also, because that is part of tomorrow's lecture, where we talk about the gut brain axis. So, this pro, pre and pro. So, now you take all that, you feel good. Right? Many of you must have heard of this gut microbiome testing, right? So, you take all that and you feel good. After that, what happens? You go for a holiday. You take a flight, you go to a foreign country, or you change your city, you go for a holiday, you eat food from a different state, then your gut microbiome goes back to square one. So, no matter whatever your gut microbiome changes on a daily basis. So, there can be no standardization of the test, because every time they eat the food, it is a different thing. Most of the supplements that are prepared come from food, correct? They come from fruits, they come from leaves, they come from bark, they come from root, they come from some part of the plant. Now, when they eat that part, they produce something else. There comes the difference between synthetic supplements and natural supplements. Synthetic molecule cannot be digested by the gut microbiome. So, that can be tested. Now, for example, one of the most synthetic molecule which is used in life saving, that comes from the plant, it used to come from the plant, okay, is atropine from the belladonna plant, correct, from the fruit of belladonna, overripe fruits of belladonna. But today atropine does not come from belladonna, today atropine comes from the lab, which is synthetic. So, if you eat a belladonna, you won't die, but you take few drops of atropine, you can get a heart attack or something can go wrong, your blood pressure can go up, down, something can go wrong. But if you are eating belladonna, so in our olden days, all these used to be part of our vegetables. If you see, India is very rich in belladonna because India has peacock. And how to identify belladonna plant? The berries, if you see the peacock, the feather of the peacock behind it has that blackish eye. Our belladonna has the same color. So, peacock color of that comes from the belladonna. So, peacock always searches for belladonna berries to eat. It is from the family Solaceae. Now, which other plant is from the same family which you ate today? Tomato, okay, potato, okay. So, tomato and potato also from the same family, but they are non-toxic, okay. So, now I was just coming into Bombay that day, and I saw from the flight, and I made a very simple picture, you know, and this you know, this was not there before, this ceiling. So when you look at it from top, you know, you feel this is like a cell, correct? These boards inside are all your cell organs, and this board that is coming out is your exosome. So whatever is coming out of the cell is an exosome. So exosome means something coming out, exo out, some something that comes out of the cell. So this is my lab where I work in Hyderabad, and anybody is always free to give me a call and you can visit our lab. We have a state of the art lab in Hyderabad. So again, I was showing you what you eat is the endocytosis, okay? Then it forms an early endosome, then that's taken into the microvascular body, that passes to the lysosome. So what exosomes are not healthy are destroyed by the lysosomes, and the healthy exosomes are excreted out. Now these exosomes are cell signaling factors. Remember, exosome means cell signaling factor. How do you signal the, what do you mean by cell signaling? If I want to turn on this AC in the room, what do? I go, I put on the switch and I turn it on, right? What is another way of turning on the AC? With a remote, correct? The amount of current in the switch is 220 volts, or it's a 3-phase 420 volts, whatever it is, correct? If I touch that current, I'll get a shock. The chance of me dying also with that shock, because it's a high current. If you put your hand in the switch that turns on the AC, the chance that you can get a shock, right? If the switch is not proper or the switch is a short circuit, you can get a shock. If that current comes into your hand, you can die. You can die. You can get something can happen. You can get some medical this and die. The second way of turning on the AC is with a remote, correct? This is also current in the remote. How much? 1 volt, 2 volts, very small amount of current. You can turn it on, you can press it. Will you get shock? Nothing will happen to you, correct? You can put it all over your body, nothing will happen to you with that. Yeah, the procedure of the exosome will take some time. So first I'll show you the kit. Where's the kit?
She's only hypothyroidism.
Normal.
Normal only.
So this is the exosome kit, and if you see, everything you need already comes in the kit. Even the what you call it, the blood drawing tubes and everything come in this. So this is a single use kit, and these are the syringes, these are the tubes where you draw the blood. Now what is special in this tube? Basically this has a different pore size. So the pore size is in the gel that we add is a trade secret, because that allows only anti-inflammatory exosomes to pass through. Pro-inflammatory exosomes will not pass through, cell debris will not pass through. So that is our trademark. And then you have this filters, again filters for filtering out the pyrogen and all that, and allowing only the exosome to pass through. So this looks like a normal syringe filter, because the body is of a syringe filter, but again the technology is in the pore size of the filter that we are this. This also looks like a normal vacutainer, but the technology is in the gel that we fill in the vacutainer. So, if you see this kit, basically there is no external thing added, no chemical added, everything is mechanical. So, nothing that is going in, any foreign substance going inside your body. Doctor went, okay, you are taking this place, you can keep it. So, coming back, we were talking about the cell signaling. Okay. So, you put with your remote, you put it on, your AC comes on, right. Now, this AC is Daikin. Okay, this is a Daikin AC. I bring yeah. So, I bring a remote that belongs to Sony. Will it come on? I bring a this that belongs to Sony, it will not come on. Samsung, it will not come on. Sony, 10 Sony remotes, will it come on? 100 Sony remotes? No, correct? So, I am giving 1000 types of signals with that remote, but still it is not coming on. What do I need? I need one signal, the correct signal. So, the number of exosomes does not matter. Everybody talks, oh, you know, I have so many million exosomes, I have so many billion exosomes, but it is only for signaling. When you need a very small signal, why would the number matter? The number does not matter as long as the docking of the chemotaxis happens properly. So, there are people saying that, oh, giving more exosomes is better, but actually it does not make any sense if you are giving the wrong signal. What happens? Then there is something called cross signaling. You know cross signaling? Sometimes all of us have mobile phone, correct? In this room, all of us can call. What happens? You will never get a cross connection because you are always going on a different frequency. But sometimes, very rarely, you may listen, you dial somebody and you listen somebody else's voice. That is a wrong signaling, but that is not very clear also that time at the voice. That is what happens when you use exosomes from other people's body or analogous exosomes or other species. Okay. Now, I have seen somebody talking about
Dr. Leroy, that patient for hair PRP, he is also there. Should I withdraw blood and keep it in?
centrifuge.
Okay.
By the time this will
Okay.
incubate.
Okay. Thank you.
So, see, the process of exosome is very simple, anybody can do it. It is the theory behind the exosome you have to learn. When you will fail in exosome, not in doing the process, it is in the patient preconditioning, and if you are not preconditioning the patients properly, then the possibility of you are not getting a good result or in fact getting a bad result with the exosome if you are not giving the cell signaling. I have some people talking about cell signaling of exosomes, this red roses exosome. How can you put plant exosomes in a human body? That is signal for the plant. How will it work? It will not work, right? Because the signal is totally different. Secondly, most of the exosome that come are made from pig or pig embryo exosome that come in the bottle. They are coming from China, they are coming from Korea, they are coming from all these places. They are pig embryonic exosome. So, I would not want to put pig or any other species of animal in my body, right. I do not know anybody would be comfortable. Thirdly, what are the exosomes problem is happening is that many of these human cultured exosomes contain microRNAs. Why would you want some other person's microRNA coming inside your body, integrating with your own genome and creating a nuisance, correct? Creating some protein. So, that is why I always suggest go for autologous exosome. So, it is from your own body to your own self. So, there is no chance of any micro RNAs and all these things.
सर जब ब्लड ट्रांसफ्यूजन करते हैं तब भी होल ब्लड जब ट्रांसफ्यूजन करते हैं उसमें भी एक्सोम होते हैं अंदर.
Exosomes are present always. So you don't do blood transfusion just for fun, correct? You do blood transfusion only in life-threatening situation. We never transfuse blood just like that. Of course, nowadays there is some new thing coming in anti-aging or so-called thing where I have seen people taking blood from the younger, yeah, not plasmapheresis, from the, I've seen on YouTube or Instagram, from the 18-year-old they are taking blood and putting it into the 50, 60, 70-year-old. I am not a fan of all these things. Why would you take somebody else's blood? You know only X number of diseases that you can test for. There may be diseases that have not yet come out, right? They may be there in your body, in that particular blood. Why would you want to infect yourself? Maybe after 10 years some other virus will be discovered which can be caused through blood transfusion. So blood transfusion should be given only if it is absolutely necessary. Even in what you call it, anemias, we give blood transfusion only when the patient is, we can see the hemoglobin falling and we've tried everything, can't do anything, then we go for blood transfusion.
Sir, in that case, they are transfusing blood or plasma?
What?
The procedure you mentioned, they are
I don't know all this.
from young people. It is
I don't subscribe to all these stupid treatments because they are stupid. They have no scientific background. Just for fun, you would take out somebody's plasma and definitely you will have microRNAs, you will have all these things. I mean, why would you want that? Because transfusion medicine is a science and we will do transfusion medicine only when it is an emergency. The fellow is bleeding, his hemoglobin is continuously falling, or a lady, I have seen hemoglobin of 2, I have seen hemoglobin of 5, then I have done blood transfusion. And even when you are doing blood transfusion, it is better to do proper blood transfusion. Don't just give one bottle of blood. One bottle of blood is not going to do much. Give always 2 units. 2 units increases the hemoglobin. 1 unit does nothing. So, and that is also in emergency situations. Okay, so unfortunately people are doing all these unscientific practices and calling it regenerative medicine, and that is why this regenerative medicine is getting a bad name because of the unscientific work done by all these people. So, okay, so we were at, what were we talking?
there is something.
No, that remote control, the signaling factor, signaling exosome. Okay, doesn't matter, we will go with the second way of signaling. Oh, this is back, front.
क्या remote है? ये?
No, that remote is not there. We kept it somewhere. I don't know where I kept it. Yeah, thank you. So,
Slide चाहिए.
yeah, signaling, just signaling. So, you see, these are the exosomes, these are microvessels, and these are apoptotic bodies. Now, if you see in cancer, cells have forgotten to die from apoptosis. That is why the cells are dying from necrosis. So, when we do exosomes for cancer, the protocol is different. It is all about your preconditioning protocol. Taking this box, taking the exosome is very simple. But how to give it, when to give it, why to give it, and when not to give it is very important. The preparation is very simple for the kit. First they will draw the blood, like now she will draw the blood, and then she will incubate the blood. Why you have to incubate? You have to incubate because when you incubate it at 38 degrees centigrade, that is 1 degree higher than body temperature. And when you incubate it at 1 degree higher than body temperature, the cells are under stress, correct? All of us are under stress, correct? If I put you in the FIR, far infrared chamber, your body will also be under stress. So somebody asked me, why are we putting him in the, why are we taking the blood and incubating it? Better we just put him in the FIR, no? He will get the exosome. I said, yes, he'll get the exosome. But what happens, unfortunately, in the FIR, in our body, there is a thermoregulation by the pituitary, which kicks into motion. You're sweating and all these things. That tries and this your body, you know. So, when we put the blood in the incubator, there is no thermoregulation. So, you get the blood gets heat shocked. These heat shock proteins stimulate these exosomes, and then these exosomes come out. So, the half an hour we are causing heat shock proteins to stimulate exosomes, and these exosomes come out. Now, before these exosomes come out, I showed you the previous slide of endocytosis, correct? The endocytosis part is basically where you condition the body. And how do you condition it? You condition it with the right nutrition. So, then there are different protocols. Suppose you are doing exosome for skin. 1 week before, you will tell the person have good amount of vitamin C, amla, you know, that kind of things, that kind of foods. Now, when you are giving vitamin C, it is important to give it with tannin, because what is the half life of vitamin C? What is the half life? Yeah, few hours. I don't know, those of you who are wearing this, what is that nowadays, everybody is that Libra freestyle GCM, glucose monitoring system, CGM. How many people are wearing? Anybody has worn before? Nobody? Okay. I have worn. Huh?
They're advising for patients.
Yeah. So, you should try it and then take IV vitamin C, and you see your sugar goes up to 500, and you see how it comes down. It is very interesting. Over a 3-4 hour period, it comes down back to 100. So, 4, 5, 6 hours is the half life. Now, when you take vitamin C orally, also the half life is 4, 5, 6 hours. It's much less than that, because how much gets absorbed? Okay, you're not going to get it at that high level. So, what do? You want to increase the retention time of vitamin C. So, you add tannin. So, when you take vitamin C, add vitamin C with tannin orally when you are giving it to them. One supplement is available, it is called BioC. It contains vitamin C with the tannin. So, it is prepared from amla. So, amla extract, vitamin C and tannin. So, that helps in something called glycation of collagen. So, glycation of collagen is very important, and because of this glycation of collagen, so the exosome gets signaled towards glycation. So, when you are putting it in the skin, what do you want? You want more glycation of collagen, you want the skin to be brighter and all these things. Okay. Then, so for different diseases, you have different types of preconditioning. For knees, arthritis, we will talk about the common conditions. It is better you ask me some conditions. Okay. So, you will for knees, you will take curcuma boswellia. Why? Because you want some anti-inflammatory stuff over there from curcumin, you want some regenerative of the cartilage, okay, from boswellia, and then you can use the same techniques that you learnt with the ozone for signaling for injection. Lungs, how will you give exosome in the lung? Very simple. Pardon? Nebulization. You can nebulize these exosomes. So, you will precondition the body for what conditions for lungs. So, you can give it for smokers, okay, people who have the cancer in the lung. So, what I had so many patients who had come with lung cancer to me. They still come, they are still alive, they are still coming. I am giving them soda bicarb, number 1. Number 2, I am giving them bromelain. Number 3, I am giving them vitamin C. Then I am giving them nanocurcumin. And I am preparing this exosome, and then they are nebulizing the exosome. Yeah. So, basically they have collected the blood in the 8 tubes.
We will collect. We will collect now.
Okay, you are going to collect the blood. Yeah, it is a vacutainer. So, it is automatic, you know. Then heart. How many patients are coming? See, all of the regenerative medicine patients will go all over the world and then come to you. They don't care, they did not get anywhere else better. But they come to you and don't get better, they blame you. I went to this doctor and did not get better. That is what is happening nowadays. So for heart, for what do you call it, CCF, for this ischemic heart disease, I am giving them good amount of coenzyme Q10. Coenzyme Q10 with Arjuna, because Arjuna also contains something called PQQ. So coenzyme Q10, Arjuna, PQQ. I am giving them L-carnitine, giving them D-ribose. Okay. So you can give them this, and then you can collect the blood, and then you can give them IV. Now, I have also put exosome inside in the principal bronchus for patients with a lot of lung fibrosis, and their peak flow meter has improved. So if the peak flow meter is improved, means physiological, their lungs are better. Correct? Peak flow meter everybody can have in the clinic. If you don't have peak flow meter, just tell them to blow the balloon. You see how much the balloon is blowing, that much you know his peak flow meter is improving. So I had put it with the principal with the endoscope, bronchoscopy, and I had injected over there. So OPD procedure, you can do that. Okay, so I'll tell you more. So what is this exosome therapy and how it is different from platelet-rich plasma? We talked about it. We talked how when you test, you will not get platelets. In the other one, when you test, you will get platelets. Okay. We discussed the difference between stem cell therapy and exosome therapy. So there are some gynecologists who are doing exosome from amniotic fluid. So while doing the C-section, they are removing 50 cc of amniotic fluid. They are passing it through the exosome kit, preparing the exosome, and they are injecting it in the scar of the mother, and they are getting very good result. And some are freezing and keeping it, and in future they will use and all that. Now, unlike stem cells, exosomes can cross the blood-brain barrier. I have been used exosome, as I told you, they are given intrathecal for about 6 or 8 patients who have continuous migraine. Migraine is not getting better, they have done everything, but migraine is not getting better. So I am not anesthetist, I cannot inject in the intrathecal space, I don't even know how to put the needle, but I have friends who are very good anesthetists who can put needle very well. So you have given it to them, they have put it and they have treated their patient, and patients have got very good result. Now still of today we do not know the mechanism of migraine. It is 100% physiological, but we do not know exactly what happens inside the brain. There are so many different theories, so many different neurotransmitters. So these are some of the CD markers, that have a cell to cell response and are responsible for the cell signaling. So now we are talking about MSC derived exosomes. So this MSC derived exosomes can be prepared from the bone marrows, because you are getting your MSCs from the bone marrows. You can prepare it from the amniotic, those of you who are doing from amniotic. Use the same kit, you can prepare it, because there is no chemical added to this kit. There is nothing wrong with the kit, it is only a mechanical thing. Okay? So there is no question of any addition of anything, it is what you, the input is your output. Our output is anti-inflammatory exosomes, our input can be different types of fluids from the body. Hair loss, I have not got very good results in hair loss, but we had got 1 or 2 very good results. I will show you that picture, and the mother of that person is here only. Skin regeneration, very good skin regeneration, you can see today, we will do it and see how our skin, I am just going through it fast, because actually exosome itself will need about 2 days, around 8 hours, 4 hours and 4 hours to talk every protocol of exosome, because it's about the biochemistry that is important. Osteoarthritis, you already talked so much about osteoarthritis, how osteoarthritis affects, how to diagnose, how to treat, and this osteoarthritis, when you give exosome, the cell signaling happens, and because of the cell signaling, cartilages start to regenerate in a small way. So this is the very good photograph or a very good drawing on the biochemistry of what happens when exosome is injected in the knee. So you will get the slides, not to worry. So you can see that the MHC class 1, class 2 factors are also activated. Okay, the integratin protein is very important. This protein helps in regeneration. There is a lot of research being done on this protein which helps regenerate, and that is how the healing starts. So you can give your exosome along with your ozone also. Ozone is not going to destroy your exosome, in fact it is going to get better. So you can give ozone, you can give exosome, and when you are giving in the joint, you can also give it IV at the same time. So it works systematically and it works also locally. Cancer cells. So these, see, cancer cell, these fellows have forgotten how to live life. People who forget how to live life get cancer. You should always live life. They've forgotten how to eat, they've forgotten how to breathe, they've forgotten how to sleep, and they've forgotten how to die. 4 things. See, when you're always running, you're eating food fast, you're not sleeping, correct? You get a cancer. Right or wrong? Stress. Everybody is under stress. There are 2 types of stress, good stress, bad stress. Tomorrow we'll talk about that. So when I talked about cancer, what do you mean? What I mean by cancer? Cancer means sugar. Okay? More sugar in the blood, more sugar in the cell, and less oxygen. He is always running, no time to breathe, no time to rest, then he prematurely dies. So premature death is called necrosis. Finished. He is dying fast, producing more cell fast, dying fast, producing more cell fast. So what you have to do, you have to teach this person. When a man comes to you like that, what do? You tell him go to a meditation camp, okay? What do you tell him? Now take a rest, go for a retreat. That's what we tell a person, right, who comes to us and says, doctor, I don't have time, I'm running in the morning, afternoon, I don't eat my food, I eat. Especially I had a very good friend who was a very big, I won't take his name, in Bombay, orthopedic surgeon. He was very much overweight, and this was 10 years ago. He, poor fellow, had a problem of obesity and overweight. He used to sleep for 1 hour or 2 hours, very rich. He had so many Mercedeses and all that, but could not get sleep. He went everywhere to all the sleep clinics, Mayo Clinic, all the clinic, but they could not treat his sleeplessness, and he was putting on weight. All I told him to do, you leave your clinic for 1 month and just go to sleep, eat food properly, don't watch the TV, put off your mobile phone. He lost 10 kgs just by doing that, not by doing anything else. So same way, when you have, now how will you train the cell? So when you take the cell, you have to train them by giving them the right nutrition, by correcting the microenvironment inside. Correcting the microenvironment is called epigenetics. How will you change the epigenetics? So there is something called adaptogens in the body. So what are these adaptogens? These adaptogens are certain biochemicals that reset your brain. Like a simple natural adaptogen is Withania somnifera, your ashwagandha. So she is just filling it in the tube. Actually you can either use it with vacutainer, or you can use it by this way, whatever way you are comfortable. In the new kit, we are getting butterfly, huh? Dr. Jigna.
Okay.
So you put the butterfly and you connect the vacutainer.
Okay. But then.
And through the same butterfly, you can put IV.
Okay. Good. Good.
So there is only one prick that's in the new kits. Whatever new kits are coming in that technology. And yeah, so we were talking about adaptogens and changing the stem cells, the cancer cells. So then you start feeding these cancer cells good food, correct? When you go to a retreat, what they do? Then they start feeding you good food. So you feed the cancer cells good food. What is the good food that you will feed them? You feed them high antioxidants, correct? You feed them high phytonutrition, okay? Or you feed them, that's this branch of pharmacology what we call as phytopharmacology, where from plants you take certain extracts and you feed it to these cancer cells. Then where you go for a retreat, you will go somewhere to the mountains, right, to the Himalayas, or you will go to some lake or some green place. Why you go there? Because you get more oxygen, correct? So what you will do to the cancer cells? You will try and give them more oxygen. How will you give them more oxygen? One, ozone. Ozone will give them more oxygen. Two, we call it oxidative. You tell them to person, you start exercising in the presence of high oxygen environment. So what I do is that I have a cycle, you know, a stationary cycle, and I connect it to oxygen concentrator, and gradually I keep on increasing the oxygen. So the person can cycle more. And today everybody wears these smart watches or smart rings, these gadgets. And what will you see in that? You will see the VO2 max increasing. Now what is VO2 max? VO2 max is how much of oxygen or how efficiently your body metabolizes oxygen is called VO2 max. So you want to increase the VO2 max, that means you want his body to metabolize oxygen better. Just putting him in oxygen is not going to make it metabolize better unless he uses his mitochondria. So how will you use the mitochondria? Where is the maximum amount of mitochondria present in the body? 1 in the heart, 2 in the liver, 3 in the muscle. Yeah, now she will put it in incubator. There is a small incubator, everybody has seen it. No. In the incubator, basically, you are going to stress the cells. You can show the incubator, na? I'll show. Yeah. Yeah, so this is the incubator, and the test tubes will fit inside this thing, and the plug point is there, we will put here. So she will set it to 38 degrees and just put it in so that the cells will be stressed. Yeah, what were we talking about? Sorry. There is no anticoagulant in this, because now the cells are being stressed, and now the exosome is being produced. So what type of exosome is being produced? Two types of exosome, inflammatory and anti-inflammatory, because it doesn't know, right? First it will start producing inflammatory exosomes, because there is no thermoregulation, it is out of the body. Then it will start producing anti-inflammatory exosomes. Then what we do to this is that we spin it. In the spinning, you will see only the anti-inflammatory exosomes coming up. That I will tell you. I will just explain you how it happens and how the mechanical action with the centrifugation force and everything happens. So, okay, coming back to the cancer. So, again different cancers have different types of. So, one more thing we have developed. This is the box, na?
You will get a sticker.
We have developed one more thing that contains all the nutrition. Now, basically we have seen some drawbacks happening with the Myers cocktail. So, we have tried to correct that, and we have trademarked and patented the formula. So, it is called Leroy's cocktail, and it is available in the box they are selling. You can just buy the box It's available in the ozone forum, and you can buy it, and you can just ready to use. That also we will come to later on. But so in different types of cancers, the preconditioning is different. Every disease, see, exosome is normally present in your body, correct? Your body needs healing, your body needs everything. This is normally exosome will be present in your body. Milk, you know the whole story of this A1, A2 milk. Why is this A2 milk better than A1? Vipul is not there. Vipul would have told the correct story. Why it is not there? Why A2 milk is better? So basically, you find certain exosomes in A2 milk. These exosomes are much more anti-inflammatory. That is why A2 milk is much better than A1 milk, the A1 protein and A2 protein. Now, this has been known in India since a long time, but we never knew the word A1, A2, protein, exosome. We used to tell, okay, this particular desi cow, this milk is good for this milk is good for that. Now, if you grow A2 cows and keep them in a stable and give them, their feed, that A2 milk is very inflammatory. Don't drink that, because cow doesn't eat grass. Okay? This grass-fed cow, the cow doesn't eat grass. Cow eats plants. If you see how cow grazes, it doesn't eat any plant. It will smell every plant. It will pick one plant from here, one plant from there, one plant. Those of you who have seen cow eating food. But poor fellow, what do? We just give him one type of grass which they grow. The fellow keeps on eating and eating that grass, which is inflammatory. You eat so much of rice, so much of wheat, you live, you won't die, right? But your body will be fully inflamed. Same thing for the cow. It has to roam here and there. It has to eat certain plants. It knows what plants to eat. Then its body produces the right milk and the right exosome. Same type of signaling. When you eat the right food, the right supplement, only then your body will produce the right type of exosome. So same way how we are doing for the cow and we are taking out the milk, here you are doing for the human, you are taking out the blood. You got it? So unless you have the right type of supplements, there is supplement rotation today. See what was happening in the olden days with polypharmacy. I would see the blood pressure, taking 3 or 4 different beta blockers. What's the use of taking 3 or 4 different beta blockers? Even in ophthalmology, they are giving 2 different beta blockers. What's the use? When beta blocker itself is not working, what's the use of increasing the dose? And they would give so much of the same drug, 2-3 different types of statins. What's the use of giving 2 statins? One statin doesn't work, what's the use of giving 2 statins? Actually, no need of giving statins. Same thing is happening in our nutrition medicine or regenerative medicine. They go to a doctor, they come with 20 different supplements. Who will take 20 tablets? Will you take 20 tablets every day? You will also not take 20 tablets every day. It's very difficult. More than 4 tablets is very difficult, tablet or capsule. So you have to keep on rotating them. Just how in the olden days you would rotate the foods, certain seasons you would eat certain foods. Same way, certain seasons, certain days you need to eat certain supplements. Now, in this good evening. So now, in this thing is that you're going to eat so many supplements. It's not possible. Patients will go mad. I cannot eat 20 supplements in a day. I forget. I don't expect the patient to eat. I tell all the patients, see, your life should be good. Food, don't compromise. Drink, don't compromise. Have good food, good drink, always. Okay, if you are drinking alcohol, have good alcohol. If you are having tobacco, have good tobacco. Don't compromise. Hey, what is this here? They are going to the doctor, don't eat this, don't eat that. Life has become so bad, I don't know, food should look good, smell good, taste good, and also be healthy. If food doesn't look good, you don't like to eat it. See, many of the huh? Like?
Not like our lunch. Sir doesn't like today's food.
No, today's food is good.
No, sir doesn't like.
Oh, sorry. In the evening, we'll get good food then. So, what happens? Many of the mothers come to me of the children and complain, my son is not eating. How many people get that complaint in a general practice? Everybody, my son is not eating. What to do? What do you tell? You know what I tell? Problem is not with the son. Problem is with you. You don't know how to cook tasty food. You cook the good food, everybody will eat. Food should look good, smell good, taste good, and also be nutritious and healthy. If it is not looking good, smelling good, I won't eat. Forget about nutrition. So that's why the science of culinary medicine and cooking came out, right? To make nutritious food, our food healthy. Okay, so coming back to the supplements. So in cancer, I see the patients taking this many tablets. Every damn thing that is available in the market. Curcumin, quercetin, resveratrol, amino, vitamin A, B, C, D, up to Z. Poor fellow comes with this much. First he'll come with this many tablets he takes. Doctor, this is my tablets. Then I'll add this many supplements. Then what the patient does? Oh, I don't need this, I don't need this, I don't need this. And then they start their own self-medication and they do. So I never do that. Only 4 supplements I'll give, 4 tablets. And I tell them, keep changing that every day. See, it's not possible for you to eat all that, your body also cannot absorb it. So have a cyclic absorption. That is also part of the preconditioning. Then your bacteria in the gut or the gut microbiome gets better and better. Today everybody is talking about this prebiotic, probiotic and postbiotic. So what is prebiotic? Huh? Food for the probiotic. What is a probiotic? Bacteria, fungal, virus, everything is probiotic, correct? Viruses also are there. Viruses also are probiotics, fungus is also probiotics. Good bacteria, like for example, you have Saccharomyces. Saccharomyces is an yeast, okay? It's a probiotic, it's not a bacteria. Then you have good viruses also. So everything is there. And what is a postbiotic? End product of the excretion is called the postbiotic. So what the postbiotics come out are the food for the cells where the exosomes are formed. You saw my first slide, endocytosis. That is the postbiotic coming out, which is endocytosis for the cell. Many a time in almost all the diseases, the gut bacteria is only not producing the right postbiotic. If the gut bacteria is not producing the right postbiotic, how will I get good exosome? Or how will I get anything? The body will not signal. So whatever we are doing is we are only concentrating, but remember the main thing is the preconditioning. And the main thing is giving the person the right nutrition so his body gets preconditioned. Secondly, the IVs. Because I am not able to get everything from the food, I take IV, correct? I am not able to absorb everything from my capsule, nutrition capsule, that is why I am taking IV. Honestly, you don't need IV, you don't need supplement. Don't need it, don't take it. What you need to live on the farm, grow your food. Because when you live on the farm sustainably, you grow your food, you get all the nutrition, you get all the probiotics, prebiotics, you get the seasonal fruits and everything. You don't need ozone also. But you have to stay on the farm. If you stay in Bombay, you need ozone. That means nobody is sleeping good. So you don't need anything, you know. It's you live on the farm, you grow your food, you don't need all this kind of stuff. But because we can't do that, then we go. If you see in the olden days, or many of the old people who are practicing would see at that time, there was no problem with zinc. Zinc was never low. Sir, you must be knowing. Zinc, hardly zinc was low. Today, you have everybody zinc low. Why like that? Why today zinc all of a sudden came up zinc? Humans were there since many years, right? Since like thousands of years, millions of years. Why all of a sudden zinc came low? See, I'll tell you, because of construction. In the olden time, when you built your house, you had a GI pipe that brought water to your house, galvanized iron. So galvanized iron means the iron pipe was galvanized with a zinc coating. Today what pipe you have? CPVC pipe. CPVC and PVC pipe. If you want to save money, you will put PVC. Those you want to have little extra money, you will put HDPE. When you are putting hot water, you will put CPVC pipe. Because of the CPVC pipe, there are the minerals, there are no minerals. What else you get? You will get microplastics. You are putting PVC, you will get microplastics. Chlorination, microplastics. After some time, will come into your food, into your pipes and all that. That is why then automatically what maintains the balance of zinc? Copper. Correct? Today, have you noticed in your patients, all of a sudden I am noticing, you can go home and try, see, copper of people are suddenly shooting up. One, because zinc is not there, so natural copper will shoot up in the body. Two, people have started promoting this copper vessel concept.
PRP के लिए precursor का use करो कि आपका
Correct? People have started using drinking copper. Why this drinking copper was done before? Because there was no zinc. Once the zinc came there, automatically the copper started going down. Then people said, okay, now because their pipes are made of zinc, start drinking in copper vessels. But today if you see again, especially in more of the luxury villas, all the pipes are moved back to copper. You go and buy any luxury property, they will advertise copper piping in bathroom, copper piping throughout the house to maintain hot water. So that is why copper is going up, zinc is coming down. So this is all about environmental medicine that we have to investigate. Secondly, cell signaling in cancer, the Wi-Fi. I'll tell you, there are different types of Wi-Fi. You just say can't put off the Wi-Fi. Everybody makes a mistake. Everybody is being used by technology. Don't be used by technology. Use technology. Use technology. Don't be used by technology. What do I mean that? If a simple way is that if you want to sleep with Wi-Fi, it's not possible today. Correct? You will put off your Wi-Fi unless you are living in a nice big house where some kilometers of garden where nothing is around, then your neighbors, you are living in a flat, that fellow has Wi-Fi on top, the fellow has Wi-Fi down, this side has Wi-Fi, that side has Wi-Fi.
for one patient full kit
Two.
two.
Okay, that is the thing. So the Wi-Fi is still there. So how to prevent that? One is that use beam forming Wi-Fi. Now everybody does not have beam forming Wi-Fi, they don't want to spend more money. So what you do is that you take a simple chicken mesh, you know that mesh, and put it under your bed. Put it under your bed, under your mattress, and connect one copper wire to the earthing. The Wi-Fi will go into that and go down to the earth. Simple. All the Wi-Fi signals will go out. No problem. Because you have to see, there is technology, and there is technology to always counter. There is terrorism and counter terrorism. There is technology and counter technology. Everything has a, yin and the yang, or good side and the bad side. So same way, again with the people with the cancers, lot of EMF. So, start giving them EMF shields. Which plant has a natural EMF shielding property? There is one plant, huh? Somebody said? Huh? Snake plant, yeah. And now, how will you tell the patient to have the snake plant? You cannot tell him to grow around the snake plant, correct? He has to sit there with the plant. Now, he comes to the office. Suppose I am working in this office. I can't bring plant and come. No? The boss will kick you out. He'll say, what is this you are bringing plants and coming to the office? So, what to do? You have to give them something else. There is another oil from another plant which is called rosemary. So, you take rosemary essential oil and you apply to your head, you apply to your this, you will, and you can test, you buy that EMF meter and you test before and after. You will see the EMF falling down by 50%. So, all this is how, this is the basis, scientific basis of aromatherapy. People laugh at all these therapies. When I talk about aromatherapy, people say, hey, he's doctor or what kind of fellow he's talking, give aromatherapy and all these things. So, when you are giving every oil, no, really, you ask your patient, I'll say somebody, I do aroma, hey, he's doctor or what, he's doing some, this oil and all, he's giving this kind of fellow. So, then you tell them, you see what is there in rosemary, okay? Rosemary is anti-EMF, and how you can test it, there are papers published on PubMed, okay? That way every oil has certain properties, like for example, if you want to heat the body, again in the cold season, you will use 3 different oils. One is ginger oil. Why ginger oil? Because ginger oil contains gingerols. Okay, gingerol is a big vasodilator. Okay, so it's a vasodilator. So what happens? You feel heat. That's why also in the cold season you have alcohol, because alcohol is a vasodilator. So people who drink alcohol know that they feel warm. So same way you have gingerol. You have ginger. In the cold you have ginger in the soup, ginger in your food. So because ginger contains gingerol, and gingerol is a vasodilator. So your body starts to increase in heat. The metabolic function. So that's why, especially now, people have coughs, colds. Very good to carry a small amount of ginger oil with you. So you put it over here, more vascular, more blood supply, less chances of you getting viral infection. Why do you get viral infection? Because due to some allergen, your turbinae expand, correct? And because of that, the mucus doesn't go away, and that stagnation of mucus breeds more bacteria, virus, all this thing. But if the blood circulation is there, it doesn't go away. So anyway, we will not talk about that because that's a different topic about oils. One day we can talk about how you use different oils to treat different conditions. So now we are also studying how exosomes in cancer can be used as a diagnostic tool. So basically, you can have certain exosomes produced in certain cancers where you can see that much before CTC, I don't know if you heard of CTC, circulating cancer cells, the exosomes come out, because exosomes are signaling factors, correct? The signaling factors come out, and that is being studied by MD Anderson to show that exosomes can be used as a diagnostic tool. That's very important. Now, exosomes in drug delivery. So, I don't know how many of you people are doing IPT, insulin potentiation therapy, for your cancer patients, insulin potentiation therapy. Anybody knows what is insulin potentiation therapy? Nobody. Okay, so I'll tell you for 2 minutes. So in cancer, I told you what are the 2 main mantras. They need sugar, more sugar and less oxygen. So how to treat cancer? Decrease sugar and increase oxygen. That is the basic mantra, correct? Now in insulin potentiation therapy, what do? We give patient first insulin. Okay? When you give insulin, what happens? Sugar gets decreased. Along with that, we give them vitamin C. Vitamin C mimics sugar in the body. So the cancer cell thinks that, arey, I am hungry now, sugar is come, so it starts eating up the sugar, but actually it's eating up the vitamin C. After some time this comes to know this is not a sugar, this is a vitamin C, but then it is too late, the cancer dies. Along with that, we give a very low, 1/10 the amount of chemotherapy drug that has been already prescribed for that particular cancer. So, this whole drip is called insulin potentiation therapy drip. So, we start this drip for the patient and we can decrease the dose of chemotherapy. I am not expert on chemotherapy, he is an expert on chemotherapy, you can ask him all the doses and the drugs, but this is the main principle. I send my patient to the oncologist, medical oncologist, they will write the protocol, which drugs to give, how to give the drugs. Before they come for the chemotherapy, I start them on a high dose vitamin C on, you can give Leroy's cocktail because that contains all the other good antioxidants to increase the NAD in the body, because once NAD is increased, the cellular respiration is increased. Okay. Then you can, I will decrease the chemotherapy dose, whatever he is giving, with my IVCT, that is insulin potentiation therapy, and then you see because of that the side effects of the drug come down, obviously, right, because the amount of quantity of drug is going in, so the side effects will come down. So, the patient has less side effects and recovery is much faster and he needs less cycles. And always with the chemotherapy, I always give good amount of amino complex. Why? Because chemotherapy is a destructive therapy, it kills everything. So, your body needs right amount of amino acids to build. Do not just give them protein, because the protein has to be broken down into the right amino acids. Now, many times cancer cells thrive on glutamine, and most of the protein has glutamine in it, correct. So, you do not want to give glutamine in cancer, we do not want to give glutamine. So, we give them aminos that are glutamine free. So, you give them an amino complex which is glutamine free. So, that helps the person recover much faster. So, that is, then we take the blood again after doing this preconditioning for 1 or 2 weeks, then you take the blood for your exosome therapy. If you just do the exosome therapy without this preconditioning, your patient will not get any good effect. They will say, oh doctor, I got some just like a normal IV. So, without preconditioning, doing this does not have much of an effect. So, this is a small picture. You can see, you can take the blood, you can prepare the exosomes, put it into the body. We have put it in the intrathecal space for especially stroke. I have done about 4 patients with stroke with my friend who is a anesthesiologist, and he is putting inside the intrathecal space and we are getting good result. We have done it for fresh strokes. So, we are trying to minimize the umbra and penumbra, right, in the brain. So, you are trying to minimize the damage. Okay. So, the decrease the amount of brain damage.
So how much will we inject
Intrathecal, so basically we are putting about 4 to 5 ml, that is it.
So we withdraw the CSF and then we.
So, see, I am not an anesthetist, I do not inject it, but I give it to the anesthetist and they inject. The normal way how they are doing it, they will inject it. So, I think 4 or 5 ml, when you put the needle, you allow 1 or 2 drops, that means you are in the space and then you can inject, but do not go on what I say, because I have never injected. I am not going to inject also, because I do not want any risk, any medical legal issues.
Sorry, hair ke liye you want any priloxine?
No, we will give local.
Sir, he probably means ki do we have to take that much of CSF out? But that's not the practice. We give local, we give spinal anesthesia, we give 4 to 5 ml. So it can be accommodated.
You do not need to take out. You can give, see, when we are giving blood patch, people give 10 ml also. But I am not an anesthetist, I am not the right man to comment, because I do not want to comment something and then tomorrow it's wrong. What is my expertise? I know. What I do not know, I do not know. I can learn that, but I do not know. There are 3 things in this world. You know what you know, correct? You know what you know. Second thing, you know what you do not know, correct? You know, that you don't know exosome. So you have come to learn exosome, right? You know what you know that you know PRP, you know it. You know what you don't know. And the third thing is that you don't know what you don't know. So in every field, these are the three things that are there, even in medicine field. So at one time, regenerative medicine was to me, I don't know what I don't know. I never knew that something like this even existed in this world. Then after coming in, we'll know. There may be so many other things that we don't know that we don't know. Okay? So, yeah, putting in the CSF, yes, you can put in the interthecal space and you can get a good result.
That's also again CP and auto.
I have not tried CP. So, she is doing a lot of CP cases. So, she is an expert on CP. So, I have not tried in CP cases. And one more case I have tried is that in basically in many of the this surgery, what do you call it, laparoscopic surgeries for healing. For healing laparoscopic surgeries, it works well. And I have 2 or 3 other friends of mine who are orthopedic people. Non-union ulcers, non-union fractures, you can put the exosome, because it will signal the cell to why non-union is happening, because the fellows on the 2 sides have gone to sleep. There is no signal for them to grow. So when you put it over there, the signaling restarts, and then the fracture this joints. So basically this had happened in the jaw. I had 2 cases in the jaw with our friend Rajshekar, dentist. He is a maxillofacial surgeon. So 2 or 3 patients had come where they had accident, and there was non-union of the mandible. It was not happening. It was been about 3-4 months. So we put exosome, and then the bone joined together, and the patient became happy. So it can be used for anywhere where the signaling goes down. We have also used in cirrhosis of liver.
You have injected around the joint, around the bone.
No, inside. Where the non-union is, you have to put the, either you can put a C-arm and inject, or you can put a ultrasound. You see over there bone, then that black, no bone, put the needle over there and inject it. Cirrhosis of liver, very good result. You can inject in the parenchyma with the ultrasound, or you can go blind also, put the needle and inject. And you can inject how much ever you want, because anyway it is cirrhosed. So there is no question of bleeding and all that. Okay, so now you see this is over, this is making the noise, that means the thing is over. So 30 minutes. So now you see over here I have dead cells, I have exosome, inflammatory and anti-inflammatory. It's all a big masala. It's just the blood only.
No suppression of the plasma and blood.
Minor will be there, but the exosome has formed.
No
Where is the
anticoagulation.
exosome?
It is all mixed. Now I will separate it. Now we will purify this exosome. So now the first step of purification is centrifugation. How much you will centrifuge? You will centrifuge at anything more than 3500 for 30 minutes. Why 3500? Because the gel gets activated at 3500 RPM. So we have tried to make it as simple as possible. So at 3500 RPM the gel gets activated, not at 3400, not at 3200. It has to be more than 3500. 3501 it will get activated, 3600 it will get activated, 4000 it will get activated.
Leroy, once we incubate, for how many hours we can keep outside the centrifuge?
So once you incubate, within an hour you should, actually less, the faster you do it the better it is. 15 minutes is good. Ideally, for the ideal condition, you should have a refrigerated centrifuge. But refrigerated centrifuges are expensive, so we can also use this centrifuge, no problem. But the ideal condition is you need a refrigerated centrifuge. It will cost you around 3.5 lakh rupees. But you can get quite good exosome even with this centrifuge. In a refrigerated centrifuge, you will centrifuge for 30 minutes at 20 degrees centigrade. I think you must be having refrigerated centrifuge. You don't have refrigerated. Okay, so if you have a refrigerated centrifuge, you get a better yield of exosomes. So again we talked about here. So this is the simple the way. Basically, you take the blood, okay, with the vacutainer, you can incubate it 38 degrees, then you spin it, and then you get it. And then there's one more step. I don't know, it's not showing. Yeah, this is the step. This is the filter. You filter it, and this is your exosome. So you take 40 ml blood. 8 tubes are there. Usually we have this vacutainer, so you don't have to think how much blood you have to take. Just fill all the vacutainers. It will stop automatically when the blood is filled.
Sir, we call it 500 RP for how long?
30 minutes. Okay. Now, this is a picture of PRP. When I see PRP under the microscope, I see my platelets. After some time, I see the platelets forming the platelet plug. Okay, you can see the platelets are coming together forming the platelet plug. Correct? This is exosome. Blank. This can go through a 30 number needle. This will block a 30 number needle because it contains platelet. Now, looking at the kit, just collecting blood, putting in this, putting in this, people will say, how are you sure this is not PRP? So this is how we are sure it is not PRP. Now, how are you sure this is exosome? How are you sure this is exosome? Right? I showed you why this is not PRP, but I have not showed you why this is exosome. I'll show you the next slide showing why this is exosome. I have taken this and sent it to transmission electron microscope. In the transmission electron microscope, we have found the exosomes. Now, exosomes from 30 to 100 nanometers have been found and seen, which are anti-inflammatory exosomes. More than that are inflammatory exosomes and cell microvesicles. That means you are making sure you are giving exosome to your patient because you have the documentation, right? Now, we have done studies saying when you do not precondition your patient, this exosomes count comes down. This is the next slide. What have we done here? There is something called a zeta sizer. This is an instrument that counts nanoparticles. So you put it in the zeta sizes and you see. These are the yellow one was where the patients are not being preconditioned. So the count of exosome is very minimal. The red one is where the fellow has been preconditioned. So you have a good amount of exosome. You see the yellow, it's only here, it's not getting that much of exosome. So that is why preconditioning is very important. If you are not preconditioning the patient, I go back, you won't have many of these things, and if you don't have many of these things, these are the cell signaling factors. The signals will not pass through. So these are the scars with the exosome therapy which we have treated, some of them, some clinical cases. This also we have done exosome plus ozone. So this is mixture of exosome and ozone. I think you all must have seen many of these cases. Vitiligo, very difficult to treat vitiligo, which we have treated. This is again for beauty, skin. I was telling you that we are putting it with the fat so that you are decreasing the chance of fat reabsorption. Because why fat gets reabsorbed when you transfer fat? So nowadays there is something called fat filler. So he's the expert in this. I am not the expert. Where you fill fat in the face, you fill fat all over the body, right? So that's called biological filler. So that works much better than your Restylane, Juvederm, and Proline and all those other fillers, Macrolene and all that. Formerly they used to use Macrolene for the breast, right, and the buttocks. Then what used to happen with Macrolene? You used to get a lot of lumpiness. Okay, and with filler there is something called as a Tyndall effect, especially patients with fair skin, where the filler starts to come out and extrude. You get a called the Tyndall effect. Now to reduce this Tyndall effect, people started using fat, so it lasts longer. It is more biologically available. But what happens with the fat filler is that it gets reabsorbed. That's the only one problem. So they do something called nano fat now, right, where you filter the fat. You filter the fat through a filter. It looks like the same like an exosome filter, but it is not the exosome filter. See, all the filters look the same because they have to fit a syringe. So the body is like a syringe filter. Correct? The same syringe filter body, where what goes inside is your technology. It's like injection. I say, doctor, give me injection. What injection to give you? Injection, everything looks like injection, like a syringe. But what goes inside the syringe is important. Same way, when you do nano fat, the nano fat filter is different from the exosome filter. It is different from your ozone filter. You can't put the nano fat in your ozone filter, it will block. And that nano fat filter, if you pass through this ozone filter, nano fat will not be produced because this is made of nylon. His nano fat is made of some, I think, cellulose or something.
Now we are getting Teflon also.
Nylon, Teflon, no, we are talking about nano fat. The difference between nano fat and synthetic filler, nano fat and synthetic filler. So how to prepare nano fat? We can't, I'm saying all the syringe filters look the same. Ozone filter, PTFE filter, nylon filter, nano fat filter, exosome filter, looking wise all the same. Why? Because the outside cover is to fit a syringe. It's called a syringe filter, but the technology is inside. That is what makes the difference. So again, he uses nano fat. His nano fat is a different this. Now for your nano fat, when you mix with exosome, you will have a 3 times more survival rate in your nano fat, because it will signal for it to stay there.
Sir, how you treat it vitiligo? You have interlesion or general IV?
Pardon?
How you treat it
Vitiligo. So we have to do 2 things. For the vitiligo, we did intralesional as well as IV. Always I do intralesional plus IV. So that gives me a better result.
Keloid also?
No, keloid is contraindicated. It will grow more. Keloid do not do exosome. It will grow more because it will signal more growing of cell. Like intratumor injection. Intratumor injection of exosome I will not do unless I have done intratumoral injection of ivermectin. Ivermectin, there you can open your Google and see how ivermectin shrinking the tumor nowadays. So we are giving intratumoral injection of ivermectin, then we can give exosome. Again another case. This is face, this is under eyes. Here also you can see many of these patients don't want to go for Botox therapy. So this is a meso exosome therapy, what we can tell them, because the moment you say meso Botox or Botox, they don't like it. Now one more case I want to show. This is not exosome, but this is our old kit which produced some amount of exosome. It was PRP lysate. Okay, this is full face. You know this patient? Yeah. So we preconditioned him, then we did. Remember in the first, so this is our Maushi's son who came, alopecia totalis. Of course, before this, the first one we did not have totally. no eyebrows also, we did not have his photo. And
So
he,
only exosome or Canacot also you use?
no Canacot.
No Canacot.
She was there, no Canacot, no steroid, but preconditioning was very good. Cell cycle, amino, every day without fail. And I think 6 months. And this is another male pattern baldness, year and year. So the people who are doing hair transplant,
Sir, you did local exosome?
local and IV, both we did, no?
Yeah.
Both we did, no? This was in the starting May, when we just took out and we
3 years back.
3 years, yeah.
I saw that previous patient. I was there.
You were there that time.
I was there.
Yeah, in that room we did.
He was having total alopecia that time.
I was thinking that it will not come back, alopecia totalis. I said we try, but it may not.
You said we will try.
So that was that time we just took out the kit and we did not know whether it is going to work or not going to work.
Work in scarring alopecia?
Scarring alopecia, yes, you have to inject properly, it will work. In your scarring alopecia, always add hylase. Add hylase to your exosome. So exosome will increase the VEGFs, hylase will break open the scar. Sometimes, if you also don't want to add that much of hylase, you take the whole exosome, you add little hylase and add 1 or 2 drops of 5-FU, 5-fluoros uracil, because even in keloid we are giving 5-FU, but patients now, this one doctor, I won't take his name, practicing in New Bombay, he contacted me that day for his cardiac patients with the keloid scars. No. He's a plastic surgeon. He's not into all these things. He doesn't believe in any herbal anything. He was like me when I joined. I don't believe in anything. So for his keloid patient, he's a cardiac surgeon doing cardiac surgery, proper cardiac surgery, getting keloid, saying I don't know anything, sending for radiation therapy. Keloid, it works very good. I have seen low radiation. It works really well. After the low radiation, many times they get a little white over there, on the scar. That time you can give little keloid with 5-FU. I mean, get exosome with 5-FU. Or give them the exosome with 5-FU and send them for the low dose radiation. So then the keloid will actually go away. So stretch marks, 10 sessions. This lot of patients are coming, especially post pregnancy and all this weight loss. The stretch marks are there. So this we are getting good result. This is for male regeneration. They want ED and all that. So there is something called shock wave therapy nowadays. So people are using shock wave therapy along with exosome, increasing of the size also with the exosome, helping ED a lot because obviously more blood flow is there. It is going to be better. Preconditioning is very important. We have to give good amount of bromelain, and we also have a mixture of herbs, okay, which is called T-Max. We give them T-Max, which contains basically some fenugreek extract, because fenugreek there is something called testofen, which increases the testosterone. So that is there in our T-Max, and we give them that along with bromelain and then do the exosome. We can inject locally as well as IV, and then they are getting a good result. And then even I attended cosmetic gynecology conference. Now in India, in Gujarat and in Maharashtra, most of the cosmetic gynecologists are also starting to use exosome in treatment for stress incontinence of urine, SUI, and especially of FSD, female sexual dysfunction. And what happens with because these ligaments, get weak as the woman ages. So that's how the SUI happens. So along with that, I give them little bit of BHRT, testosterone and all that, BHRT, and then I will inject the exosome. We have working with some gynecologists in our clinic who will come and they'll inject. In Bangalore also there are certain gynecologists who are injecting exosome. So you have to inject around, so basically we'll inject it in the external vulva, and we'll go on the anterior vaginal wall for the SUI part.
And preconditioning is done by various hormones, you said?
So testosterone we'll give for local application.
Local application.
Because SUI, what happens when they cough and all the muscles have to get tight. So I'll give them T-max because I want more testosterone in the woman. Because in the menopause, even though the estrogen falls, progesterone falls, testosterone also falls.
There is lot of SUI problem in females. And how many settings of exosomes?
2 or 3 sittings, 2 months, 3 months apart, and then they are good.
Has to be repeated or that's...
Sometimes with one sitting, if they are getting good result, it's okay. Some people will tell little is remaining, you know, like that.
You add some medicine after that?
No, we are not adding any medicine. We are giving them oral supplement. We are giving them good amount of amino complex, good amount of Bio-C. We are giving them T-max and local application of testosterone cream.
Testosterone, you don't use estrogen?
Estrogen, ma'am, we will not use because we are not doing HRT. Most of the Indian women already have phytoestrogen, which is high. So they are lacking progesterone. So I'll give them progesterone, this cream, and I'll give them on the urethra every night. Apply this much as a pea-size amount of testosterone cream, because estrogen, most of the Indian women already have estrogen. Secondly, estrogen we get a lot from phytoestrols, which is there in paneer, soya, and all these things. Okay, so now we will prepare the exosome.
No, I am just
Yeah, finish the
centrifugal, but it is ready. For
Cent-
hair, it is ready.
huh?
For hair, it is ready.
For hair, okay. So we'll do the PRP first, and by the time this will go on.